Well, nurses at the Duong Community Health Planning and Services compound can now heave a sigh of relief after a two-bedroom house was handed to them. The nurses were hitherto staying in rented apartments after a storm collapsed the single room constructed for them. The delivery room at the CHPS compound was turned into a staff accommodation for a midwife to attend to obstetric emergencies. Rafiq Salam has the rest of the story.
One major challenge faced by nurses posted to rural communities is the lack of accommodation. Most of the CHPS compounds constructed have little accommodation space for the nurses, forcing them to look for accommodation sometimes far away from the facility. The Duong CHPS compound is no exception. It was constructed for the community by the Japan International Cooperation Agency, JICA. The community on their own mobilized to put up this single bedroom to accommodate the nurse in charge, who later collapsed 3 years ago. As a public health nurse and knowing the importance of accommodation to the work of nurses, Queen Mother of the Duong traditional area, Pona Rosemary Bangzie, mobilized resources for the construction of a two-bedroom house to accommodate the nurses. With support from individuals and USAID, she was able to achieve her target.
It will interest you to know that the nurses in Duong CHPS compound have been running the facility for over 5 years without staff accommodation, because the only staff accommodation that was there was washed away by one heavy rainstorm in 2018. Since then, majority of the nurses reside in the community, and some staff who were posted to the community rejected the posting due to accommodation challenges. Since then, our delivery room has been turned into a staff accommodation just for a midwife to stay closer in case of any obstetric emergency, especially in the night.
Our Social Minister, Dr. Hafiz bin Sali, urged other Queen Mothers in the region to emulate the example of the Duong Queen Mother by initiating similar projects to improve healthcare delivery in their respective areas.
The exceptional leadership of Pona Rosemary, which has provided the community with this new facility to accommodate the health personnel stationed here, is exemplary and worthy of emulation across the region. I therefore urge the other Queen Mothers who are here to grace the occasion to also initiate such an initiative.
Deputy Country USAID OT representative Dali Haj Omar spoke of the projects embarked on by his outfit aimed at bettering the lives of the people.
USAID's Littorals Regional Initiative, or LRI, started programming in northern Ghana in April of 2021. We recognize that conflict dynamics in this region, such as intra-Muslim tensions, farmer-herder conflicts, and land and chieftaincy disputes, threaten the region's peace and stability. We are here to help local partners in the north strengthen community cohesion and to build their capacity to help them identify vulnerabilities and take initiative to resolve local issues peacefully.
Our Regional Director of Health Services, Dr. Damien Pouiri, spoke of the benefits that the people will derive from the project.
The region currently has 312 CHPS compounds, which happen to be the highest in the country for now. Over the past few years, the Regional Health Administration has worked with stakeholders to expand access to CHPS services to every part of this region. As of June this year, the region achieved 100% CHPS functionality. This means that every person living in the region has access to a well-trained community health officer within 5-kilometer radius. However, one key challenge that is facing the 24-hour availability of CHOs in the CHPS zones is the availability of staff accommodation. For instance, only 62% of these numbers that I mentioned earlier of CHPS compounds in the region have at least just one staff accommodation. In the absence of staff accommodation, the staff have to commute daily to their workplaces, meaning they will not be available, especially at critical times like in the night.
Reporting for News, Rafik Salam, Duong.